Welcome. Today, we're going to do a real clinical deep dive. We're looking at one of the most fundamental pieces of cognitive behavior therapy. Think of this as a practical guide for when you're in the room with a patient, how we actually get from their surface-level pain right down to the very foundation of what they believe about themselves, and then how we help them start to rebuild.
You've heard this, right? We've all heard some version of this in our sessions. It's such a simple, powerful statement. But here's the thing. It is not just a passing thought. This is our way in. It's the very tip of the iceberg, and it leads all the way down to the deepest parts of a patient's suffering.
And that right there is the key. For the person sitting across from you, especially when they're really struggling, this isn't just their opinion. It's a fact. It's an absolute truth that colors every single thing they experience, every success and every failure.
So what are we really talking about here? Core beliefs are these huge, all-encompassing, and pretty rigid ideas we form about who we are, and they usually start way back in childhood. You know, for a lot of people, positive beliefs are what guide them day to day. But these negative ones, they tend to just lie there, kind of dormant until something like depression or anxiety hits, and then they wake up with a vengeance.
Okay, so to get a handle on this, we're going to use the framework from Aaron T. Beck. He's sorted these negative beliefs into 3 main buckets, and as clinicians, our first job is just to listen. We listen really carefully to figure out which one of these categories seems to be the most switched on for our patient.
So take a look at this. This table basically organizes the language of our patient's pain. Are you hearing themes of failure, of not being good enough, of inadequacy? Well, that's pointing you towards helplessness. What if it's all about rejection and being alone? Then we start to hypothesize it's about being unlovable. Or is there this deep, pervasive sense of being morally flawed, just bad or toxic? That's the worthless category. Our job is to listen for these patterns.
All right, so how do we actually get there? How do we go from what a patient says, that automatic thought that just pops into their head, all the way down to the core belief that's driving the whole show? Well, our main tool for this is what we call the downward arrow technique. It's a way of gently, carefully peeling back the layers.
And this just lays it out perfectly. Look, we start with something concrete, the situation. Then we nail down the automatic thought it kicked off. And then, here it is, the key question. And if that were true, what would that mean about you? We just follow that chain of meaning, question by question, deeper and deeper, until the patient finally lands on that big fundamental belief. In this case, I'm incompetent.
Finding the belief? That's really only half the battle. Now we have to shift gears into modification. And listen, the very first step, the one you can't skip, is psychoeducation. We have to teach the patient what this thing even is. You can't change something if you don't understand how it works. This is all about building our team, our collaborative alliance.
These are the absolute essentials we need to get across, and honestly, the most powerful one is right at the top. A core belief is an idea, it's not the truth. Just that simple reframe, it opens up a whole new world. It tells the patient, hey, this thing you think is a fact, we can question it, we can test it, and together we can change it.
Now, to explain why these beliefs are so sticky, a good metaphor is worth its weight in gold. And one of the best ones I've found is this idea of a mental screen or filter. It's a concept that patients they get it instantly.
So let's imagine how this actually plays out. Our patient, Sally, she believes she's incompetent. So when she gets a B on a test, that information sails right through the screen. See? Proof. But what happens when she gets an A? Well, that screen goes to work. It distorts the information. She'll think, oh, the professor must have graded easy, or that exam was a joke. The evidence that contradicts her belief never actually lands, and so the core belief just gets stronger and stronger.
Okay, so once the patient gets the mechanics of their core belief, we need to give them a tool, something practical and structured that starts the process of rewiring their brain. And for that, the core belief worksheet is incredibly effective.
And that's exactly the question this worksheet is built to answer. It takes all the abstract stuff we talk about in our sessions and turns it into a concrete daily practice. It really empowers them to start becoming their own therapist.
Before we can even start with the worksheet, though, we need a target. We have to work with the patient to create a new, more balanced belief. And notice, it's not some crazy positive affirmation like, I'm a total genius. No, it's realistic, it's flexible. I'm competent in most ways, but hey, I'm only human. That's a belief someone can actually live with.
And here's the worksheet in action. It's such a brilliant two-pronged attack. In the left column, the patient is on a mission. They're actively hunting for any piece of evidence that supports their new, balanced belief.
This literally retrains their brain to start noticing the good stuff. Then, on the right, they don't just ignore the negative stuff. No, they catch it, they write it down, and then, this is the magic, they reframe it. They find other explanations besides, I'm incompetent.
Now you have to be ready for this moment. It is a critical point in therapy. The patient will start to get the logic. They'll say, okay, I can kind of see it intellectually, but I still feel like I'm incompetent. Our job in that moment is to just normalize it. The emotional belief always takes longer to catch up. We just have to reassure them that's a normal part of this. Keep practicing, that gap will close.
So let's bring this all together and add one last really powerful technique. This one is especially helpful when those beliefs are super dug in and rooted way back in a patient's history.
This technique is called the historical test. You're basically taking the patient back in time to the scene of the crime where the belief started. They dig up all these old memories that seem to prove the belief is true. But then, we guide them to find evidence from that same time that contradicts it. We help them look at those painful memories again, but this time with their adult wisdom, so they can write a new, more balanced story about their life.
When you get right down to it, every single technique we've talked about, the downward arrow, that worksheet, the historical test, they're all designed to do one thing. They're all about building a bridge, a connection between the rational part of the mind and the emotional part of the mind, so they can finally start having a better conversation.
So, I'll leave you with a question to carry with you into your own practice. When your patient is sitting there, totally convinced that they are worthless, what is the very first piece of evidence, no matter how tiny, that you are going to help them find to start building a new story?